Hello, and welcome to the
Sisters in Medicine.
Today on the Sisters in Medicine, we'll be discussing a very well-known disease state. What is it, ladies?
Hypertension.
Also known as
High blood pressure.
High blood pressure is the leading cause of doctor's visits in America and across the world today. Most patients with high blood pressure do not have their blood pressure under adequate control. Hypertension, also known as high blood pressure, is classified as having your systole over diastole greater than or equal to 120 over 80. Your systolic blood pressure is the top number on your reading. It measures the force of blood against your artery walls, while your ventricles, the lower two chambers of your heart, squeeze, pushing blood out of the rest of your body. Your diastolic blood pressure is the bottom number on your reading. Blood pressure is definitely, when you want to think of it, you think of the systole as the top number, 120, and you think of diastole, the bottom number, 80, and that's considered the range that you should keep it below.
Exactly. So systole, you think?
Contract, and diastole, you think relax. Now, honestly, it's always good to just know your numbers and go to a local pharmacy to check your blood pressure, because they usually have those like Hickey machines that you can go in and just put your arm in and it's automatic and you can just check your numbers. Because even if you're not really in a bind, or you've been prescribed or diagnosed as having high blood pressure, it's good to just be aware, because at the end of the day, your blood pressure is very important. It's your health as well. So when you do check your blood pressure, it's always good that if you do smoke any cigarettes, use any nicotine products, drink alcohol or drink caffeine, that you wait 15 to 30 minutes before checking your blood pressure, because alcohol, nicotine or tobacco, and caffeine can immediately increase your blood pressure by 5 to 10 points or millimeters per mercury.
Nobody wants a false elevation when you're checking blood pressure.
No.
And at that point, if you're not sure and you're taking it at a pharmacy with the Hickey machine, always check with the local pharmacist. I mean, I always take people's blood pressures when they ask me to. And it's always nice to do it manually and also look at the electronic Hickey machine. You kind of get an idea of what the blood pressure range actually is.
Yeah. But it's always good to know what signs and symptoms to look for, so that you can avoid even being sick and go to the doctors before anything escalates. So Amanda's going to discuss some of the symptoms that you can face if you happen to have.
Thank you, my love. So, with high blood pressure, it's very scary because you can have it and not even know you have it.
Yeah, that is true.
Did y'all know that it was called the silent killer? Because you basically can have it and symptoms won't show up until it's too late. So that's really scary and very important that you pay attention to it. Studies have actually shown that 1/3 of people with high blood pressure don't know they have it.
That's a lot.
So the best way to check accurately if you have it is regular checkups with your PCP or primary care provider. But not everybody has the luxury of going to a doctor all the time. It is a luxury that not a lot of people have. So, like Ashley and Andrea mentioned, the Hickey machine at your local pharmacy. Check with your pharmacist and they'll help you out.
Definitely. And I just have to say that at my pharmacy, I do free health screenings where we take your blood pressure, your blood sugar, and your blood cholesterol readings. So if you happen to be in a Stop and Shop or get a chance to check it out, please feel free to take advantage of this resource, because knowing your numbers, your health is ultimately your wealth.
Very true.
I feel like a superhero.
I am a
Sisters in Medicine, here to save the world. So, with high blood pressure, there are some symptoms you should watch out for. So, these symptoms include severe headache, chest pain, difficulty breathing, irregular heartbeat, vision problems, and or blood in your urine. So, if you have any of these symptoms, please seek medical attention as soon as possible, right away, because it's very important. You could be having a hypertensive crisis. Now, what a hypertensive crisis is when your blood pressure is greater than or equal to 180 over 120. The diastolic number being 120, the bottom one down, and the systolic number being 180, systolic top. Now, with a hypertensive crisis, you could have a heart attack or stroke. So you guys know how serious that is. You need to pay attention to your numbers, and you need to take care of yourself. So like I said, seek medical attention if you experience any of these symptoms. Now, with these symptoms, it's not end all be all. There are things you can do, lifestyle changes, and prevention. So everybody's gonna let us know
I do that, you bring up hypertensive crisis actually reminded me that I had a patient on rounds the other day that presented with a hypertensive emergency, so I got to see firsthand how scary it can be.
So what's the difference between hypertensive crisis and emergency?
So like you said, a hypertensive crisis, your blood pressure is greater than 180 over 120, but with the hypertensive emergency, you actually get a systolics to the 200s. And then with a hypertensive,
so it's worse.
Yes, if your systolics going to 200s, that's so unsafe, you could die.
Okay.
And then from there, you could progress to a hypertensive urgency, where your systolics are to the 200s and you're getting end organ damage. This patient actually presented with an urgency, a hypertensive urgency, and their kidneys started failing, and it was pretty serious. We had to rapidly decrease their blood pressure within 24 hours with multiple medications. Yeah, it was scary. So, but I got to see firsthand. So you bringing that up reminded me. But on to lifestyle modifications, because we definitely want to know what we can do.
Exactly.
We don't want to die.
You know, it's funny though, before you even go into that patient, you don't know if they present with symptoms prior, because
No, I think they actually checked their blood pressure at a pharmacy, and they like presented to their pharmacist and was like,
so
what do I do? And their pharmacist recommended they go to the emergency room.
room. So it just goes back to exactly what my dad says, or I guess our dad. Our dad is a pharmacist, and he always says, you know, there's a bunch of dead men walking around. And what he means by that is that, you know, you're walking around not knowing what your numbers are. And since blood pressure is a silent killer, you're literally just a dead man walking if you have high blood pressure and you don't know it and you're not being able to treat it. So, you know, all humor aside, know your numbers, get into your pharmacy or your local primary care provider and get it checked out.
Yeah.
But yes.
Lifestyle mod.
We need to know what to do. We need to know, girl.
So there are definitely some things you can do to help prevent high blood pressure. One of the main ones being weight management.
Okay.
So a BMI greater than 25 is considered overweight. BMI greater than 30 is considered obese. In America, you know, we are unfortunately the land of the obese. We have a show called My 600-Pound Life. Like, what other country does that?
We do have a
It's
show.
actually kind of crazy. It's kind of disgusting too, but besides the point. A BMI greater than 25 is overweight. So you would want to maintain a BMI between 18.5 and 24.9. Now the one caveat with the BMI though is that it doesn't take into account your muscle mass.
Exactly.
It takes into account your height and your weight, but not your muscle mass, because according to my BMI, I'm overweight. Do I look overweight, guys?
You look
I don't
good.
look good. But we don't need to get into that. So you definitely want to maintain a healthy BMI. And actually, I found this pretty interesting. By losing 1 kilogram, you could actually decrease your blood pressure by 1 millimeter of mercury. So I thought that was pretty cool.
So if you lose 2.2 pounds,
1 kilogram is 2.2 pounds. You can decrease your blood pressure by 1 millimeter of mercury.
So
that's awesome.
motivation.
Yeah. You also want to adopt a DASH diet to help prevent hypertension. And by DASH, I mean dietary approaches to stopping hypertension.
Love that.
DASH.
Yeah.
How do you remember
Love
things?
you put a dash to that diet.
Okay then, so with a DASH diet, you want to increase your intake of fruits and vegetables and decrease your intake of foods high in cholesterol and saturated fat. So basically just eating right. You know, we know fruits and vegetables are what we need to be eating.
Yes.
And by applying a DASH diet to your life, you could actually decrease your blood pressure by like 8 to 14 millimeters of mercury. So that's even better. And going along with that, you want to decrease your sodium intake and increase your potassium intake. You also want to moderate your alcohol consumption. That means no more than 2 drinks for men or 1 drink for women. And lastly, you want to increase your physical activity. So get out there and do some intense aerobic activity 3 to 5 times a week for 30 minutes. So remember, dietary changes, physical activity, moderate alcohol. You got this, guys. But you know, lifestyle mods don't work for everyone. So I know Andrea would love to talk about treatment.
Exactly. So if you get diagnosed with high blood pressure from your primary care provider or a cardiologist, let's say, they may or may not put you on a medication to manage your blood pressure. First-line medications often used to manage blood pressure include drugs called ACE inhibitors and ARBs. I'm not going to go too much into it, but basically these drugs work by relaxing your blood vessels. So ultimately allowing your blood to kind of run smoothly through your vessels. Now, let's take a straw, for example, in order to create a visual analogy. Think of how small the entrance of a straw is and how tiny it is. Now imagine pushing a lot of fluid through that straw. It would get constricted, it would be hard, you know? And what that would do is it would increase the pressure of that fluid going through that straw. Now, take your blood vessels, for example. Now, with blood pressure, high blood pressure, oftentimes your vessels constrict. That means they kind of squeeze up, they tighten up. And it makes it hard for the blood to pass through. So when you take an ACE inhibitor or an ARB, it relaxes those blood vessels and allows the blood to go on through. Other first-line medications used for blood pressure management include calcium channel blockers. They also relax your blood vessels but work differently from ACE inhibitors or ARBs. And then another first-line class of medications are diuretics. What they do is in the name. They diurese you. So what that means is it's going to increase your urine production and allow you to get rid of any excess water and salt. Water and salt can also raise your blood pressure. So by getting rid of it, you bring down the pressure. Now, if these first-line medications don't work, it's still not the end of the world. Your doctor might put you on a second medicine as well to kind of boost the effect of the first one and ultimately work together synergistically to lower the blood pressure. A common medicine that they'll use to adjunct or add on to your blood pressure management is beta blockers. And beta blockers work by basically slowing down your heart rate, slow it down, and then they ultimately lower your blood pressure at the same time. So oftentimes, if you do get diagnosed with high blood pressure, your doctor will manage it with medication, and these are the type of medicines that they will put you on. But aside from medications, like Emery discussed, lifestyle modifications are so important. So that means having a healthy diet, decreasing the amount of salt that's in your diet, taking 8 to 10 glasses of water a day, exercising regularly, quitting smoking. Smoking is a really bad habit that can actually increase your blood pressure, and just ultimately being aware of what your blood pressure numbers are. It's important for you to know your numbers. We treat blood pressure because we want to prevent a stroke, a heart attack, and even death. And that's why it's so important for you to know whether you have high blood pressure or not. So if you have any questions on any treatment management or what to do, hit us down below. But knowing your numbers is so important. Your health is your wealth, guys.
Knowledge is power. And Sisters of Medicine
power.
here to bring you the knowledge you need to keep yourself healthy.
Yeah, exactly. Thank you.
Just get help. Don't forget to